When I come to work, I think there's several goals I have. I want to have a positive impact on the families that I deal with and their babies. I want to have a positive impact on the environment in which we work in terms of my nurses and the broader staff and the medical community. My favorite thing now is in dealing with families and helping them to adjust to a new baby in the family, especially if they have a baby in the intensive care unit, because it's very hard to assimilate that baby into the family and have the family treat the baby like they're a normal member of the family when they have a few weeks or a few months in the intensive care unit. So I really like the concept of family-centered care, where we bring families into the units, where we have them in individual rooms with their babies, where they can spend time doing what we call kangaroo care, where the mothers actually put even tiny, tiny preemies on the ventilator directly on their chest. And we find that it normalizes vital signs of the babies. The babies sleep better, they tolerate their feedings better, they maintain their temperatures better. There's so many advantages for the baby that it's almost, I almost don't even worry about the advantages for the mother anymore, but there are obvious advantages for the mother as well. Family-centered care is sort of an umbrella term for a lot of new interventions that we're doing in intensive care units around the country, and that our group is really trying to incorporate into our practice at all the hospitals here in Jackson. And Baptist Hospital with its new NICU is a perfect place to really adapt the family-centered care principles. And so it's not just having the families involved, but it's providing an environment that is beneficial for the baby's healing and growth, as well as for the family and the staff. So it's better for us to practice in units that practice family-centered care than it is in units that don't, because they're more peaceful, they're calmer, they're quieter. You can actually sit down and sort of more rationally think easily over what the very complex problems are in our intensive care babies. One of the most important things, I think, in the new intensive care unit is use of human milk. And human milk makes an incredible difference for the health and well-being of all of our babies, whether they come at term or preterm. It improves the health of mothers, and it's the best preventive health measure there is in this country, and it's free. So we should be using it for all our patients, and it ought to be a universal intervention. But in the intensive care unit, it's particularly important because it will reduce the length of time babies are in the hospital if we can use human milk from the very first day when premature babies are born and use it throughout their hospitalization. So that means that we use donor milk, which is donated by other breastfeeding mothers, and then it's pasteurized and treated just like cow's milk is for milk you get at the grocery store. But this is human milk that provides protection against many of the complications that premature babies develop in the intensive care unit. And it's probably the single most important nutritional advantage we have right now for premature babies, is use of human milk. I like to think that there's a lot of medical decisions that we make in the intensive care unit, but there's not very medical decisions that I make that I don't include families in the process. Now, I certainly don't ask what dose of a drug that they want me to give, but I'll talk about almost every drug intervention unless it's an absolute emergency. I like to discuss decisions to start caffeine, for instance, which is a drug that's used in premature babies to control apnea of prematurity or where they have spells of not breathing. And it's a decision to make, and it's not always an obvious benefit because there are side effects, and so I like to include them in the process of deciding when to start it and when to stop it. And it's a simple thing, but it makes them feel like they really are a part of the process and that they really do have control over what's going on with their baby. And it helps bring them into the intensive care environment in a more comfortable way so that they can participate in successful discharge of very complex patients.